All right, all right. Let's see. Thank you everyone for being here. Still a little early. I'm just testing out a few things. Making sure you guys can hear me okay. Give me a thumbs up if you guys can hear me okay. All right, excellent. Perfect. So how's everyone feeling these days with the quarantine and the mandatory lockdowns? You can type them in the chat box. Just so I can get a feel of how everyone is taking it. Excellent. Well, we're getting some pretty positive comment. Nice, very positive comments. So most of the people are saying they're doing well, staying busy, staying in a routine. I'm going a little stir crazy, being locked home. I know I am too. But I've actually been super busy putting this presentation together for you all. Probably close to 30 hours I spent putting this together, doing the research. So I hope it provides some value for you all. I've got people who are cooking more, staying healthy, trying to stay healthy. Excellent. And lots of Netflixing. Yep. Me too. Spending more time cooking could be the best thing to do during this lockdown, because keeping your nutrition on point and your immune system healthy might be the most beneficial thing you do, versus what most people do is buy all the packaged processed foods off the grocery store shelves, and that's what they're eating, which leads to inflammatory issues, which suppresses your immune system function, and so on and so forth. We're going to talk a little bit more about that in a bit. All right, so 10:31. I'm going to go ahead and get started. Let me see here. We got quite a few people. We had about, I don't know what the last number was, but last time I checked, which was 2-3 days ago, I had 90 people register for this webinar, and more registered in the last minute. So quite a few people on here. I had a couple questions about the recording. So I am recording the webinar. Those of you who are registered will get a recording in your email of this webinar to share. I'm going to be offering a really cool special offer at the end, so you're going to want to stay tuned to the end. Plus, with all the beneficial information I'll be giving you. Definitely have a notepad, pen, paper, something with you if you want to take notes for some of the info I'm going to be dropping on you to do. And we're going to go ahead and get right into it, because I have about 65 slides I need to get through with all of you. I think I probably went overboard with the research, but given the atmosphere and the environment we're in, and the amount of false information circulating, which is causing more panic and more hysteria, I wanted to focus a lot on what research is available. So to put you at a little bit of peace of mind, and to teach you how to be proactive about your health. All right, so let me set my timer, because like I said, I have about 65 slides I have to go through. And if I spend a minute on each slide, that's about 65, 70 minutes of this presentation. So I don't usually like to keep people that long, because attention spans are short, but let's be real, you got nowhere to go. So as long as I keep you entertained, we shouldn't have people dropping off the webinar. But like I said, you will be getting a recording anyways. All right, so let's get started. So my name is Dr. Ernesto Medina, founder of the Bay Area Health and Wellness Center here in San Jose, more specifically Campbell. That's all my contact info, our clinic website. And you are here for immune support and antiviral strategies, a nutraceutical approach. I have a couple of people saying they can't hear me anymore. Can people still hear me? Yes, yes, yes. Okay. Everybody can still hear me except for a couple few. So check your sound settings on your computer. All right. So like I said, I'm not an immunologist. I'm not a virologist. I'm a clinician. My degree is in chiropractic, but in all 50 states in the United States, chiropractors are considered primary care physicians. So with my license, that allows me to order blood tests and stool tests and urine tests and MRIs and X-rays and all those diagnostic studies. Just because most chiropractors, you probably know, don't do that and just work on your neck and your back. That's not what I do. So most of my practice consists of working with autoimmune, immune compromised people, people who have suffered from head injuries, concussions, and it's many years later and they're still having issues. So the point of that is to tell you that assessing the immune system and reinforcing function of the immune system is something I always do. And it's pretty vital to autoimmune and immune compromised patients. Many of these patients do have underlying chronic viral infections or bacterial infections that have never been picked up on or tested for by their primary care doctors. And so we come here and we run very thorough, very comprehensive blood tests to identify those things and basically get rid of them or suppress them. And we do that without the use of medication, with the use of controlling inflammation, lifestyle, targeted supplements that have in the research have been shown to fight infection and specifically viral infections. Okay, so that's my background there. All right, so the purpose of this presentation I put together was really to help decrease some of the panic, fear, and anxiety and the mass hysteria that's going on. Um, it's also to teach you how to be proactive during this time of quarantine. Like it sounds like most of you are already doing, cooking and paying more attention to your nutrition and not eating out or eating all the canned packaged foods that flew off the shelves, which is great. Teach you how to strengthen your immune system against infection. And that's really all infection, not specific to coronavirus or COVID-19, but all infection in general. Because in a sense, this COVID-19 is just another viral infection like any other, with a few caveats here and there. And I'm going to teach you how to use supplements or nutraceuticals to support your immune system to function better against viral, bacterial infections, whatever it may be. So I had a lot of internal struggle when I started putting this webinar together, because it is such a controversial topic and there's so much misinformation. When there's misinformation, it causes a lot of panic and hysteria, and emotions run wild, and people tend to think more emotionally and less logically. And so I've only been advertising this webinar for 1 week on Facebook to get as many people, as big audience as I could. And just in the 1 week, I've had people, insulting me, calling me names on my Facebook comment feed, saying, "Tell us the information now. We don't want to wait till Saturday. Tell us now. The world's going to end. We need to know now." And more insults and more insults. And well, to be honest, those probably are the people who are also stealing groceries and supplies from seniors and elderly at the grocery store anyways. So we don't really want them here anyways. So for any clinicians, health coaches, doctors who are in the group, or anybody who is just interested in finding out more about this, these are the instructors that I have had through my career that have been super influential in basically teaching me how the immune system works, how we can influence the immune system, how to work with autoimmune patients, how to assess the immune system. without the use of pharmacology and medication. All right. So if anybody has interest in looking at those, you can type those in. You'll find them. Amazing, amazing clinicians and researchers and teachers. All right, so a quick disclaimer. The information in this presentation is meant for educational purposes only and not intended as medical advice. Always, always, always consult with your doctor before starting any supplement or nutritional program. But what you're going to find out as we go through this presentation is if you ask your doctor about supplements or nutrition, usually you get shot down, you get told it doesn't work. I've heard it all from my patients who talk to their doctors about it. So really, you're going to need to find a functional medicine trained practitioner or doctor, which is someone like me. So that's all I'll say about that. So before we go on, real quick, you're going to want to write this down for all of you newbies here in the chat. I'm going to give you a phone number. Number is 408-752-5453. One more time, 408-752-5453. And that's for all the people who are calling in because they may not be able to see this presentation. And basically, at the end, I'm going to give you guys a cool offer, opportunity to look at some of the supplements we have that can help support your immune system. And to contact us and get access to our calendar to schedule something, you're going to text the word immune to that number. Okay, I'll show you this number again towards the end. All right, so just text immune to 408-752-5453. All right, so let's get into the information here. This is a pretty cool resource that you all should have. This basically, the link is at the top, worldometers. Basically tells us the cases worldwide of corona, total deaths worldwide, total recovered worldwide. It breaks it down even further into countries, and from the country, at least in the United States, breaks it into states as well. You can see on the right side there. All right, so let's focus your attention on the first one, the world counter on the left here. So quite a few people infected, right? Quite a lot of deaths, which is very sad and tragic. But if we look at the bottom here, active cases, I want you to notice that the majority of cases, in fact, 95% of active cases are in mild condition, which means they're likely just self-quarantined or being monitored with minor issues, okay? Of that, the minority actually end up with serious or critical conditions. 21,000 is still a big number, but proportion-wise, it's very, very, very small. Now, if you look to the right side there where it says closed cases, right next to active cases, closed cases refers to when these infective cases have resolved, what is the resolution? And overall, you can see 84% completely recover and get discharged from hospitals, and a whopping 16% actually pass away and die. But that varies from country to country. Okay, so I'm going to show you some more numbers here. And although that 16% is high, more than half of that is coming just from Italy and Spain. Okay, other countries' death rates are super, super low. And so although it is high, it is dependent on country. Okay, so we're going to talk more about that in a bit. If we look at the United States, so we look at the big graph on the right side, the United States itself, a lot of cases, and I recently saw people posting that, oh my God, the United States is number one as far as infected, and yes, and it's probably going to continue increasing as more testing gets done. One of the biggest things the United States has failed at is getting test kits made and distributed out so people can be tested and know if they're infected or not. They're just barely, the United States is just barely getting on top of this and shipping out test kits within the last week. So this number of total infected in the US will likely continue to increase, and that's normal. Okay, nothing to freak out about right now. Total deaths has been super low, which gives us about a 1.5% death rate, but all these cases are still pretty fresh. So they're still in the active case category. They haven't closed yet. Okay, so it's still an estimate, probably most likely a low estimate, because we still have the active cases going on. Okay, but if we look at trends from other countries and overall, if 95, 97, 98% have mild symptoms and 97, 98% fully recover and are discharged, then I don't predict that that number will go much higher overall. Okay, now let's look at China. China, the epicenter of all this, had a total number of 81,000 cases, and we skip down to active cases at the bottom here. You can see their active cases are very small. So the majority of all their cases have now switched over to the closed case category. They have resolved. And if you look at the closed case category here, you look at the number of recovered and discharged, 96% fully recovered and were discharged, 96%. And only 4% of those were deaths there. Okay, so you can arguably say China was the epicenter. Their population is so huge. Hospital healthcare system is so bad. You would expect the death rate to have been much, much greater for as poorly prepared as they were. But even there, we saw fairly low death rate. And you can see on the right, this graph on the right was also taken from the same website that I cited earlier, showing that their huge influx of new cases spiked back in early February and has pretty much returned down to baseline now. All right. Now let's look at countries who are actually handling this appropriately and well. You can look at South Korea, who has really been what should I say, celebrated for handling this situation so well. They only had a total number of cases of 9,000, which is incredible. If you look at active cases at the bottom, their current active cases, 99% are in the mild condition and only 1% in the serious or critical. If we look at total closed cases, even the total closed cases, 97% fully recovered and were discharged, with a very low 3% of deaths there. Germany, same thing. Even though Germany had a lot of confirmed cases and infections, if we look at their active cases, which the majority are still active cases, they haven't closed yet, 100% of those are in the mild category. And 0%, so 23 of 32,000 are in serious or critical. If we looked at closed cases, 95%. But as these active cases continue to resolve and move over into the closed category, the recovery percentage is likely going to go even higher, something probably close to South Korea, 98, 99%. So I hope that helps put some things into perspective for you. Now, if we look at Italy and Spain, the places that have been hit the hardest by far, you can see high number of total cases, right? Total infections. But if we slide down to the bottom, active cases, even in Italy and Spain, total active cases, 94% and 92% in Spain are still mild conditions, right? And 6% here in Italy becomes serious. Now, here's where the big disconnect is. Here's where the big problem is. Of these cases that finally resolve, if we look over to closed cases in Italy, only 56% recover, right? That is very, very low, causing a high number of deaths, 44% of deaths, which is very, very sad. So what's happening is there's a big disconnect between those that are getting ill, getting access to care, which then causes a higher death rate in these countries. And that can be no access or poor access to hospitals, to hospital beds, to medications, to ventilators, whatever it may be. There's a big disconnect here because overall, the majority, 94% and 92%, are still having mild symptoms where they can probably self-quarantine for 14 days and symptoms resolve on their own. But the majority of the closed cases are ending, well, not the majority, but a huge number resulting in death. So again, that's due to a disconnect between access to care from when infected, becoming seriously ill, and getting the care they need. So that is a big problem in those countries. And if you look at the total death count for Italy and for Spain, like I mentioned earlier, if you add these two up, they are more than half of the total death worldwide. Okay, so that's where the majority is coming from. That doesn't mean that's going to be the situation in the United States, right? Now, this is probably the only opinion piece I included in this whole presentation. Maybe not an opinion piece, more of an investigative piece. I wanted to not include any kind of opinion pieces in here because everyone has opinions and they're always different and causes more confusion and anger and hatred towards other people. But this was a New York Times article that came out, and basically it describes titles can't get tested, maybe you're in the wrong country, right? And you can just Google that, put that in the Google and find it, but it breaks down what the United States did and how the United States failed at controlling the spread of the virus, and what other countries like South Korea, Germany, and Australia did to jump on this early and control it much, much faster, not needing to quarantine and shut down the economy throughout the entire country. And by far the biggest thing was test kits and testing people. So the countries right away started mass producing test kits and distributing them out throughout the country so they could identify who was infected and they could self-quarantine versus quarantining everybody blindly, not knowing whether they're infected or not, right? So you can look that up. Very interesting piece that explains a lot of what the US government did. The other big thing I'll say was that the CDC also at this time denied aid from other countries as far as getting test kits. And the CDC pretty much put a restriction on all other private labs in the United States to make their own test kits. And they controlled that ban up until just a couple weeks ago, early March. CDC wanted to control all the test kits being manufactured, made, and distributed. And the big fault was, well, the first kit they made was terrible. It failed, for one. And so they couldn't keep up with the demand. So just in March, they actually started allowing private labs to start making their own test kits. But they're so behind on the curve. I've been waiting for my labs that I work with to notify me that kits are ready to be ordered. I just got an email last week saying that there will be kits available. On Wednesday, I contacted them. They said, oh no, the FDA, we're still waiting for the FDA to let us put them into circulation. So we still don't have any access to test kits. So it's been very, very difficult to get tested in this country. Right? Now, if we compare viruses, we're going to compare, again, there's the citation, same website. Let's talk about MERS. So MERS came into existence or was discovered in 2012, the outbreak. MERS stands for Middle East Respiratory Syndrome. Found mostly in the Middle East. It was a novel coronavirus, just like COVID-19 is a novel coronavirus. MERS was a novel coronavirus. And SARS, which was also a novel coronavirus, just like COVID-19. You can see the years there that they were an issue. SARS in 2002, 2003, and MERS in 2012, and then again in 2015. Now, if we compare coronaviruses to coronaviruses, we can see the infection rate was much, much lower for MERS and SARS. Biggest reason being they were not as easily spread or as infectious as COVID-19. So that's a big, big difference there. But the other huge difference is the death rate of SARS and MERS was pretty high compared to COVID-19. Now, this is estimated for COVID-19, 2%. Now, that's still an estimate. It's still early, of course. It could go up, it could go down. But in my opinion, I expect it to go down because as more people have access to tests, we're going to find out that way more people have the infection than are reporting. But because their symptoms are so mild, they don't see a doctor, they don't go to the hospital, they don't get tested, right? So as that total number goes up of infection, death rate percentage goes down. So that's a big thing there, okay? So if we're going to compare pandemics, really we want to compare COVID-19 So we got a quick question. I want to try to answer questions at the end. But basically, SARS and MERS weren't considered pandemics. They were considered epidemics because the cases were so small, and they were small because infection was not as easy as COVID-19, for one, and probably government people acted sooner or differently to control it. I don't know. That's just speculation. But if we're going to compare pandemics, we want to really compare COVID-19 to the H1N1 swine flu of 2009. Right? We're going to go over some numbers regarding the swine flu in 2009, but it was tremendously more infectious, as far as we know, based on the numbers right now, than COVID-19. Yet the death rate, which this death rate, I believe, was calculated like 3 or 4 years after passing of H1N1, was only 0.02%, right? It's very, very, very low. So let's look at numbers. This is from the CDC website again on H1N1. If we compare numbers of COVID-19 to H1N1 in 1 year's time, from April to March 09 to 2010, total number of infections is estimated to be 60 million people, right? And that's an estimate. That's just mid-level range. The actual estimate can be as high as 88 million and as low as 43 million. So they picked the middle number, 60. And of the people infected, the vast majority were young adults, healthy people, ages 18 to 64 years. 35 million infected, right? So something we're going to talk about in a little bit is that COVID-19 tends to target senior populations older than 65, 70 years old, while H1N1 targeted supposedly young, healthy adults mostly. And of the total cases, and this is, this is the United States only. This is not worldwide. This was 60 million in the United States. And of total deaths in the United States, we had that number at 12,270. All right. So in terms of pandemics, COVID-19 doesn't even match up to other coronaviruses. Really want to compare it to H1N1. So I ask you this question. Given how infectious H1N1 was and the fairly high death rates of 12,000, right? In the United States, we're only at what did I say? 1,200, 1,500. United States, we are at 1,300, right? The United States, we're in 1,300 right now. Total deaths for H1N1 was 12,000. I asked you this question. Did you self-quarantine in 2009 when H1N1 was rampant? Were you in the same panic and hysteria in 2009 when H1N1 was going around? I don't know. Did you know anybody affected by H1N1? Right? So that's a question to ask. Now, the other reason H1N1 was also taken so serious is because probably the most detrimental pandemic in our history of the United States or the world was the 1918 Spanish flu, which was a variation of the H1N1 virus. And estimated deaths during that year time frame was 50 million worldwide and 675,000 just in the United States. So now how does H1N1 and Corona match up? Well, it seems like Corona may not be such a big deal as H1N1 and some of these flu viruses, right? But I'll let you decide that. We're gonna keep going through the information. So let's compare. If we know 1918 pandemic killed 675,000 in the United States, there hasn't been another pandemic or epidemic that has killed that many people since, including H1N1 of 2009, SARS, MERS, or COVID. But what does kill close to that number in the United States every year? Heart disease, right? Every year, about 647,000 Americans die from heart disease. Where's the hysteria for that? All right, so let's get into the actual information you want to know. This is from here forward, it's all research papers, right? Research papers are boring, I know, but like I said, I wanted to keep as many opinion articles out of the presentation and just give you the facts that we have so far. So I'm going to highlight a couple things. I'm going to explain them, break them down so it's easy to understand. Let's see. So this coming out of International Journal of Surgery. And if anybody wants to look at these research articles later, I always included the title and the citation, the volume, the year that it came out. So you can always Google this. And if you know how to do research, you'll be able to find it with that information. So what do we know about COVID-19? Very little about the pathophysiology. Basically, current knowledge is derived from other coronaviruses in the past, and coronaviruses have been around a long, long time, not just MERS or SARS, but many, many before that. We're going to talk about that in a bit. And they're typically transmitted. So most of our information is coming from all past coronaviruses. Typically causes upper respiratory tract infections, typically transmitted via respiratory fomite, it's called, which is essentially saliva, breath. Typically, they're most contagious when people are symptomatic. However, the big issue that's been different with COVID-19, this novel coronavirus, is that incubation period, which means amount of time you can have the virus and not show symptoms can be anywhere from here it says 2 to 10 days. Here, public health officials are recommending 14 days. So let's say 2 to 14 days, which is much, much, much longer than most other coronaviruses. So this is what has been the big issue and contributed to such a big spread of the virus. So big issue, most people can have it, not know it, be asymptomatic, and spread it. Okay. Now clinical features, if we come to the right side, most symptoms are dry cough, fever, diarrhea, vomiting, and myalgia or muscle pain. So those are the most common symptoms to be aware of. Individuals with multiple comorbidities are prone to more severe infection of COVID-19, so a more exaggerated infection response to the immune system, and may also present with kidney injury and ARDS, which stands for acute respiratory distress syndrome. So not being able to breathe. That is the main clinical feature. Now, down at the bottom here, it says extensive laboratory tests should be requested for patients with suspected infection. Okay, and it lists pretty much some of the tests they recommend. Elevated C-reactive protein. Now, I want you to remember that C-reactive protein, or CRP. And in your notepad, you can write that down, CRP. And then ESR, lactate dehydrogenase, creatinine. So what's interesting is in this paper, it says extensive laboratory testing should be done. But they label it as extensive because these tests aren't usually done, right? If you go in for a physical, you go in for a checkup, your primary care doctors are not running these tests. One, because they're expensive and insurance doesn't want to pay for them. So what's unique about what I do and what most other functional medicine trained doctors or practitioners do is this is almost always part of our baseline blood test. Anybody who comes in and starts care with us, we are checking these values because they are markers of inflammation. And what is the chronic driver of chronic disease like heart disease, high blood pressure, diabetes, all these things, stroke? It is inflammation. And what we're going to find out is underlying chronic inflammation also leads to worse outcomes in a COVID-19 infection, right? So again, these things are baseline. We always screen for these things in everyone because there are a lot of people, especially if you have chronic health issues, walking around with high inflammatory levels. I hope that makes sense to everyone. I'll give you a quick story about this. About a year or two ago, my parents started having me run blood tests for them. My dad, who probably at the time was 64, 63 years old, was doing his yearly physicals, yearly blood tests, always told he was healthy, normal, good, everything's good, looking good. I run his blood test, and of course, I screen for these things that his primary care doctor does not screen for. And what do we find? His C reactive protein, his CRP, marker of inflammation, was 3 or 4 times higher than normal. So he was one of these people chronically inflamed, not even knowing it, doctors not even screening and checking for it. I identified it, and in about 6 weeks, by changing his diet, resetting his digestive function, putting him on some basic supplements, we brought that back down to normal. Right? So that those are the people who tend to be at higher risk for worse outcomes. All right, so let's see here. At present, no effective antiviral treatment or vaccine is available, right? So a lot of information I keep hearing also is people waiting and hoping and praying for a vaccine to come out. But as I showed you earlier, all of the other countries did it and controlled it, and even China brought their curve back down to baseline without any new vaccines or treatments. Or new treatments, I should say, just the current treatments that are already accessible. Yet, I wouldn't be surprised if the United States pushes for a vaccine and starts mass producing it, and so on and so forth. All right, so here's another research paper. This is looking at 82 death cases of COVID-19, and again, most of this stuff is coming out of China because it did hit there first. They tend to have the most data. So 82 death cases. Looking at 82 death cases tells us what? Basically the same thing. First box at the bottom here, it says high systemic immune inflammation. 100% had high C reactive protein levels, so that CRP, 100% of people had that elevated. And then the LDH marker is also high. So again, all the same inflammation markers we talked about earlier. More than half, if we go up to the top right here, more than half of dead patients were older than 60. So that was about 80% were over 60, with a median age of 72 and a half. The bulk of the comorbidities that were present in those that died were hypertension, so high blood pressure, they had heart disease, they had diabetes, cerebral vascular disease, which is blood vessel issues, can lead to strokes, and cancer. Okay, respiratory failure, so the ARDS I mentioned earlier, which is acute respiratory distress syndrome, so respiratory failure, damage to the lungs, remained the leading cause of death. Following sepsis, which is basically systemic body-wide infection, which is not good, causes multiple organ failure and very poor outcomes. Cardiac failure, hemorrhage, renal failure, blah, blah, blah. So furthermore, respiratory, cardiac, hemorrhage, hepatic, which is liver, and renal, which is kidney. Basically, what this is saying is 100% of patients had respiratory issues, 89% had cardiac issues, 80% had blood flow issues, and so on and so forth, right? So these were the issues that came on, I believe, after the infection, but they already had underlying comorbid factors of the high blood pressure, heart disease, diabetes, cancer, and so on. At the bottom here, respiratory failure is the main cause of COVID-19, but either virus itself can release storm-mediated damage to other organs should be taken seriously. So basically what this is saying is, yes, the virus infects, but the people who are having the worst outcomes and who are even dying are dying because the cytokine storm, cytokines are basically chemical signals released by the immune system that either increase inflammation or decrease inflammation. They can be pro-inflammatory or anti-inflammatory. So what's happening is the infection is triggering the immune system. The immune system is having this high increase in pro-inflammation signaling, which the individual who is already inflamed before becoming infected is just tipping them over the edge, and it's causing massive organ damage, damage to the lungs, damage to the heart, further damage to the heart, and so on and kidney damage. Okay, hope that makes sense. Now, I have read, I'm gonna go back real quick before I show that. So I have been reading that in the United States, I have heard that in the United States, or I read, I should say, that something like 50% of hospitalizations are young people. Okay, so why that? What's the explanation to that? Well, my best guess would be essentially this. The other public health issue we were having at least in Santa Clara County, was this massive public health issue of vaping and e-cigarettes. All right. Now, the only reason I know so much about this is because my sister-in-law, who works for the public health department, she was part of a team tasked with educating young people the dangers of e-cigarettes and vaping. And so for 6 months to a year, all we heard about was e-cigarettes and vaping and how dangerous it was. But it was definitely a huge public health issue, and there have been multiple cases, probably as you've heard, of acute lung damage and lung failure in young people during the vaping issue. Okay, so that's all I'm going to say about that. Oh yeah, why do I have blank? Oh, there we go. Had a delay in the system. Okay, so here's another study looking at 112 cardiovascular disease patients who did end up getting infected with COVID-19. So of these, basically summary of this, they were broken up into two groups, critical group and the general group. Basically, the higher BMI they had, the worse outcomes. And those of you who don't know what BMI is, BMI stands for body mass index. It is basically takes your height and weight ratio, tries to calculate what your overall fat is. So basically, higher amount of fat you had, the worse outcomes you had, right? Which, I mean, is kind of common sense. Too much fat is an inflammation factory. High amounts of fat also contribute to diabetes, which is also an inflammatory disease. And so it's not really a big surprise, but this is what this is saying. So among non-survivors, there were 88% with a BMI that was higher than 25. Okay, so that's all this is saying. The lower the BMI was, the better outcome you had. So again, that's the argument for exercise, having more muscle mass, muscle to fat ratios, and moving, being active and being healthy. All right, so now we know those with underlying medical conditions are at higher risk, and those that are older who tend to have more underlying medical conditions anyways are most susceptible based on the data we have currently. Those being heart disease, diabetes, high blood pressure, vascular issues, and I added in here immune suppressed and immune compromised people, and then possibly asthma, people who suffer from chronic asthma issues, and then smokers and vapors that I also added in here. Okay, so let's look at what we know about corona currently, coronavirus in general. Coronaviruses have been around a long time, like I said. This paper was taken from a medical microbiology book. Coronaviruses cause acute mild respiratory infection, so a common cold, essentially. Transmission is through airborne complete droplets of the nasal mucosa. So nasal mucosa is another word I want you to write down and remember. We're going to talk a lot more about this, nasal mucosa. The virus replicates locally in the cells of the epithelium. Okay, epithelium is another word I want you to remember because we're going to come back to both of those. Epithelium basically refers to basically the internal skin lining of different tissues. In this case, we're going to be talking about the inside of the nose, the back of the throat, the upper respiratory tract, and inside the lungs. Okay, so this virus basically attaches in our nasal mucosa. That's why you're recommended not to touch your face to minimize infection. It replicates, the virus replicates in the lining of the skin, in the back of the nose or back of the throat, or the upper respiratory tract, and it causes damage and inflammation locally in those tissues. If we look down here, the appearance of antibody in serum and nasal secretions is followed by resolution of the infection. So it replicates locally. Our immune system, it touches our mucous membranes in the nose and the back of the throat. Our immune system gets activated and destroys, in a healthy response, the immune system destroys that infection where it's at, and it does not spread further. Okay, that's if you have a healthy immune response and are not chronically inflamed. If we skip to the bottom here, treatment of common colds is symptomatic. So basically it's describing coronaviruses as common cold. No vaccines or specific drugs are available for it. Right, so that's our understanding of coronaviruses in general. Remember, COVID-19 is a novel coronavirus, so never seen before, just like MERS was, just like SARS was. Right. So again, if we talk about the hope of a vaccine, like with flu, well, it didn't seem to help much. I mean, did it not help much in 2009 with H1N1? Probably not, because so many people got infected. But if we look at effectiveness, so total vaccine effectiveness of yearly flu shots, this is again from the CDC, and you can see here in the red box, the flu shot is all over the place. Rarely over 50% effective. Most of the time you can see you got 29%, 38%. At highest, you got 60%. At lowest, you've got 10% effective, down from 04 and 05 at the very bottom. So that's all I'm going to say about vaccines and specifically the effectiveness of the flu shot. So the basics. So let's really get into a little, because I'm going to be showing you some of this research on what supplements you can be and probably should be taking to help your immune system. I have to lay down some foundational pieces. So I already explained to you what epithelial tissue is, kind of the lining found in the inner surfaces of different cavities or organ systems. Specifically for this presentation, we're focused on the nose, the back of the nose into the throat, the upper respiratory tract, the lungs, and the intestines as well, right? We're going to be concerned about the inner lining of the intestinal wall. And I'm going to explain to you why. This epithelial tissue is our barrier system to the outside world. It is our first line of defense to any pathogens, whether it be viral or bacterial or anything else. Okay, so first line of defense, it is our barrier system. And the digestive system, just like the inner lining of the intestines and the stomach, is a whole nother barrier system to the foods that we eat, right? So the foods we put into our mouth and eat do not get into direct contact with our blood. The digestive tract separates that, and it's protective. That's why food poisoning, and anytime we get exposed to something in our food that's bad or eating bad food, we have a reaction of either vomiting, diarrhea, because that's our barrier system of our digestive tract trying to protect us from becoming fully infected and inflamed. So if that bacteria gets in contact with our bloodstream, it is bad news. Okay, so it's another protective system. This is out of a medical textbook here. This is just different types of epithelial tissue, which we just talked about. You can see found in the inner air sacs of lungs and lining of the heart. Others found inside the lungs and the bronchi, and then in the trachea and upper respiratory tract. And you can see what they do. They all do something different. They either allow things to diffuse and infiltrate into our bloodstream, or it secretes mucus and enzymes and moves mucus, right? So again, that is an immune response. It is a protective barrier system to the outside world, right? You can think in cases of asthma, for example, that pollen comes into contact with our eyes, our nose, our mouth, triggers sinus issues, congestion, runny nose, postnasal drip, causes asthma, because that is our epithelial tissue, our barrier system coming in contact with that outside world, and that is our exaggerated immune response to that pollen or dust or whatever it may be. All right, so basic immunology. right? Now, this is super important for you all to understand basic immunology, because in these times of novel outbreaks, so many unknowns, too many different professional opinions. What I find that is, if we bring it back down to basics and basic understanding of physiology or immunology, principles are the same. So our immune system is broken up into two basic arms, right? You have one right arm and the left arm. The first arm is called the innate immune response. Okay, so you're going to want to write that down. That's what we're going to focus on, the innate immune response. It is defined as the first line of defense against non-self pathogens. It consists of physical, chemical, and cellular defenses against pathogens. Okay, its purpose is to immediately prevent the spread and movement of foreign pathogens throughout the body. Right? Remember, we talked about how the past coronaviruses infect the epithelium of the nasal mucosa, or the back of the throat. That's where our innate immune response activates, attacks it, keeps that virus from replicating and spreading to other tissues. That is our first line of defense. It is in our barrier systems, and it is what we're going to focus on mostly today. The innate immune response is also considered or called your Th1 immune response. Okay, so remember that, Th1 innate immune response. Our second arm of the immune system is called the adaptive immune response. Okay, it is the second line of defense against pathogens. It is highly specific to a pathogen. So, well, that's all I'm going to say about that. It is highly specific to something. It's also referred to as acquired or specific immunity. It is specific only to the pathogen presented. This is important here. It is designed to attack non-self pathogens, but can make errors and attack itself. When the adaptive immune system makes errors and attacks itself, that ends up being autoimmune disease. Okay, so adaptive immune response is very necessary. It is a natural part of our immune system, but too much Th2 or adaptive immune response can trigger or lead to autoimmune diseases, right? So that's the other one I want you to remember, Th2. So we have innate Th1, we have adaptive Th2. The other thing you need to know is, as usually these two systems work on a teeter-totter. So when Th1 is high, Th2 is low, and when Th2 is high, Th1 is low. So they have to be in perfect balance to have a healthy, balanced immune system, right? So this is another graph basically saying the same thing. In a graph form, we have innate immune response. It is the first line of defense. It is immediate, the first 96 hours. The adaptive immune response is second and happens after the 96 hours, okay? One of the big things I want you to remember is this word called natural killer cells. They are part of the Th1 innate immune response. They kill virus and bacterial infections, okay? All right. The other basics here. Initial inflammatory response is necessary to mobilize the immune system in response to damaged tissue and fight infection. So this is normal. It is normal to initially become inflamed. That is your body's natural response to fight infection. While it is necessary, it should subside as it goes into kind of Th2. People who are having the worst outcomes with COVID-19 are already chronically inflamed. They get infected. They have more inflammation, which is a natural immune response. But that load of inflammation all at once causes massive tissue damage, especially to the lungs, and they have very poor works, okay? A prolonged inflammatory response is not good, right? We just talked about how Th2, when it's present for too long, makes errors and can trigger autoimmune disease, right? Comorbidities that we just talked about earlier, diabetes, heart disease, high blood pressure, etc., are diseases of heightened chronic being in a heightened chronic inflammatory state. All right, so Last piece, I think this is the last piece about basic immunology. As elevated body temperature. So this is a study coming out of Science News. Basically, it's saying that a fever is necessary and a natural response of the immune system fighting infection. Okay. However, it is common practice in the United States that when you start to notice a fever, what do? We try to kill that fever with ibuprofen, Tylenol, Advil, whatever it may be. Right? So this is one of the questions that I got in the chat not too long ago, but this is also what I've been reading about a lot, is that they say don't take ibuprofen for COVID-19 because it makes the infection worse. Well, in theory, if we're basing this off principles and basic physiology, suppressing in a fever is diminishing natural immune response. Now, that's not to say fevers can't be dangerous. They definitely can be dangerous, especially when we're in that situation where inflammation does not subside and go back down, like in COVID-19 infections with poor outcomes. So it definitely should be watched. It should be monitored. You should try to use other methods of controlling the fever. But if it does get too high, you definitely do need to do something and intervene or seek medical attention. But this practice of immediately trying to kill fever is not necessarily a good answer or a good thing to do. So really quick, the paper here. Let's see, CD8 cytotoxic T cells capable of destroying virus-infected cells and tumor cells is enhanced by mild fever range hyperthermia. T cell membranes, which may help mediate the effects of microenvironmental temperatures on cell function. Okay, so basically, the fever, the increase in temperature, helps kill off the viruses. Okay. So I hope that answers that question about should we take Advil, ibuprofen, the articles coming out of why you shouldn't do this, why you shouldn't do that. All right. So how do you strengthen your immune system? The real reason you're all here. So here we go. Broke down into 4 basic things. What you need to do, you need to minimize baseline inflammation levels, right? I've been really hitting that hard the whole presentation, because the higher inflammatory load you have when you're infected, the worse outcomes you're going to have, because your total inflammation load tips over the top, and then you get higher risk of massive organ damage. So minimize baseline inflammation levels, strengthen barrier systems. So that is the epithelial tissue, that is the mucous membranes of the lungs and the digestive tract. Those are all things you want to strengthen. When we talk about these terms of leaky gut or breakdown of the intestinal membrane or intestinal barrier, we can get leaky brain, which is a barrier system separating our brain and neurological tissue from the bloodstream, and then leaky lungs, which is this idea of the barrier of the lung system breaking down. We have to have an adequate Th1 innate immune response to kill pathogens at first contact, which stops viral replication and spread to other organ systems. And we're going to talk about nutraceuticals that actually help do that. And then at the very end, you want to manage the inflammatory cytokine storm. You want to manage the massive inflammatory load, especially if the person is already highly inflamed and then gets infected. Okay, and again, I'm going to describe some nutraceuticals that help with that. All right, so let's talk about the first one. Oh, before we go into that, this is kind of a summary paper I recently found. It's entitled Potential Interventions for Novel Coronavirus in China, a Systematic Review. Basically, what this paper does is it looked at all the potential therapies that I imagine were used or experimented with in cases where either medication wasn't available or ventilators weren't available, and so on and so forth. You can see they talk about in the chart on the right, vitamin A, B vitamins, vitamin C, vitamin D, vitamin E, omega-3 fish oils, selenium, zinc, and iron. And on the right of that graph, you can see there the things that those have been shown to influence. You've got MERS, you got measles, HIV, ventilator-induced lung injury. That's an important one we're going to talk a little bit more about, and so on and so on. Different influenza viruses in there, okay? All right. So what do we want to do? We want to minimize inflammation levels at baseline. That means you need to get assessed probably quarterly. I recommend my patients quarterly get a comprehensive blood test with me to screen for inflammation levels. All right, and we do that through our comprehensive blood testing we do here. You want to identify food sensitivities and inflammatory foods. Okay, now this is something most people probably is a foreign concept for people, but all my patients that come in here, we always talk about this because chances are most people have sensitivities to certain foods. They just don't know it. If you experience bloating, indigestion, heartburn, diarrhea, constipation, headaches, sinus congestion, worsening in your breathing, worsening in your cognition or your ability to think clearly, you likely have food sensitivities and you just don't know it. There's very fancy blood tests that can screen for this, but the way we do it in my office is we have people do a 5-week elimination diet. And we give them a whole packet that goes home with them. They identify, basically for 5 weeks, you eliminate the high inflammatory foods, and then you reintroduce one at a time to identify which ones cause you symptoms. What happens in those 5 weeks is that your system essentially sensitizes to those foods, and when you reintroduce it, it causes an issue and you know it pretty quickly. Right? High inflammatory foods in general are wheat, soy, dairy. Okay. Avoid consumption of sweets, excess sugar, refined carbohydrates, and packaged foods. I think that one's pretty straightforward. Avoid toxic or hysterical people and group chats that increase stress. All right, so let me expand on this a little bit. So the state of the country is already one of fear, panic, confusion, hysteria. And now you have a group chat with friends or family members, and every day someone's texting in the group chat negative things about what's happening, about people dying, the situation being terrible, this and that and the other. And to be honest, probably the best thing I could have done for myself and my mental health was to block myself from the group chats that we were in with friends and family members. I know it might sound harsh or terrible, but the amount of hysteria alone that was in those group chats, I couldn't handle it. It was definitely causing more stress and anxiety for me. So the best thing I could have done was 2 weeks ago, like I said, is I blocked myself out of those groups. All right. And I haven't been happy. I've been happy since I did that. So that might be something you need to consider doing. Now that you're armed with the information from this webinar and some resources, you can continue doing your own research and make your own educated opinions. Stop listening to, the peanut gallery who has a million different opinions and everyone thinks they're an expert in the topic. And it drives me nuts, right? So I'm sure it probably drives you nuts too. So the reason that's so important is because stress has been known to increase inflammation and suppress your immune system. Okay, so that's a big, big, big one, managing the stress, avoiding the hysteria, and just living your life armed with education. Okay, exercise is the other big one. So it's difficult that we're quarantined now, but you still need to be active and moving, right? We're still allowed to go outdoors. You just have to be isolated, right? Or 6 feet away from people. Go to the park, take advantage of when the sun is out. Get some sunshine. Sunshine increases your vitamin D, which we're going to talk about, really helps your immune system. And that's a big one. So you must stay active. And then sleep regular hours. So it's very tempting when there's nothing to do to either sleep all day and stay awake all night, or go to bed very, very late and wake up late because there's nothing to do. But regular sleep at a regular normal hours, like 10 p.m., 11 p.m., is vital for proper immune system function. And it drives Th1 innate immune response. So sleeping can help you fight viral infections. Okay, now let's talk about strengthening barrier systems. Super important. We talked about the epithelial tissue and how the coronaviruses in the past kind of latch on there, replicate, and then once they replicated enough, spread. So like I said, we're going to be focusing on nose, throat, upper respiratory tract, lungs, and the GI system, the digestive tract. The reason for that is a lot of viruses have been known to replicate also in the digestive tract. In fact, I didn't include a paper on it, but latest information coming out on corona is that, or COVID-19, I should say, is that it does in fact replicate in the digestive tract and is present in stool. So aside from breathing and breath, eating food contaminated with fecal matter will also cause an infection, right? The other thing I recently discovered was that even after someone is had the infection, it goes away, it resolves, you can still pass, supposedly, I haven't seen any research on this, but I was listening to a lecture, you can still shed and spread the COVID-19 virus through stool matter. Okay. Okay, so the intestinal microbiome and health. The intestinal microbiome is essentially the balance of good and bad bacteria in the digestive tract. That is our microbiome. If you haven't heard already, then you're a little behind on the times, but 70 to 80% of our immune system resides in our digestive tract. So what we put in our mouth directly influences the health of our microbiome in the digestive tract and in turn our immune system. Right, so you can see this paper, it's a little small, but I'll read the highlights for you. Let's see, what constitutes a normal or healthy intestinal microbiome is an area of active research, but diversity of that microbiome is super important for health. A number of factors influence the microbiome, including age, the host immune system, host genetics, diet, and antibiotic use. So all those influence the immune system either in a good way or a bad way. And likely the microbiome plays a critical role in the healthy human immune system and metabolism. So that's all I'll say about that. You can go back and read the paper later. Here's another paper, effects of, so basically the summary, the point of that paper was to tell you the microbiome, the digestive system, the digestive tract is super important for the immune system and how it functions. Glutamine. So this paper is on glutamine and its effects on systemic inflammatory response syndrome. So glutamine is a nutrient available over the counter, typically labeled as L-glutamine, is a product that I use pretty often in patients in a product called RepairVite. It helps strengthen the barrier system, specifically of the intestinal tract. This paper is looking at how the use of glutamine actually decreased mortality rates in people who had been already systemic inflammatory response syndrome. So quick highlights, we investigate the effect of glutamine-enriched diet on intestinal permeability and infectious morbidity. Most frequent infections were pneumonia. And conclusion, glutamine-enriched diets can decrease nosocomial infections in patients with systemic inflammatory response syndromes. Again, systemic inflammation predisposes you to worse outcomes of COVID-19. Higher inflammation decreases your ability to fight infection and decreases your Th1 immune response. Right? Here's another paper, the role of the gut microbiota on insulin resistance. Right? So again, we talked about body mass index, the amount of fat or maybe abdominal fat specifically, that abdominal fat being inflammatory. That inflammation increases your risk for type diabetes, which is another word for insulin resistance. Insulin resistance basically is type 2 diabetes. And this paper basically talks about how a healthy microbiome and a healthy digestive epithelial tissue, decreases risk of insulin resistance or type 2 diabetes. All right, here's another paper, interplay between the commensal microbiota, gut barrier integrity, and mucosal immunity regulates brain autoimmunity. All right, so again, I mentioned at the very beginning that some of the populations we work with are autoimmune patients, concussions, brain injuries, and neurological autoimmunity. This paper basically describes how the interplay between the microbiome, the epithelial barrier system in the digestive tract affects the immune system, mucosal immunity, and the brain. Okay. Gut microbiome. Basically, this paper is saying it's called Gut Microbiome, Westernization and the Disappearance of Intestinal Diversity, is pretty much telling us that the Western diet, also known as the Standard American Diet, the acronym is SAD, SAD, the very sad, unhealthy diet of Westernization, is causing disappearance of the intestinal diversity, which directly influence function of our immune system, the integrity of our epithelial systems, and that's another problem, right? So again, the diet, the food you choose to eat, the things you put in your mouth directly influence our immune system. Another paper, Microbiota and Aging. Basically, this paper is telling us that older populations, older people have decreased diversity of the microbiome, which predisposes them more to infections, systemic infections, and inflammation. Okay. So zinc, let's talk about zinc. That's another supplement you want to write down. We talked about gluten. Let's talk about, or specifically L-glutamine, if you look for it at the stores. Let's talk about zinc. So here's a paper titled Zinc Decreases C-reactive protein. There's your CRP that was elevated in 100% of COVID-19 hospitalized patients. So we know that zinc here in this paper decreases C-reactive protein, lipid peroxidation, and inflammatory cytokines in elderly subjects. Okay, chronic inflammation and oxidative stress are common risk factors for atherosclerosis. Zinc is an essential micronutrient that can function in an anti-inflammatory and antioxidative agent, and as such, it may be atheroprotective. It may have atheroprotective properties. So there's your heart disease protection with zinc, as well as anti-inflammatory and decreasing CRP. So zinc is another one, right? Here's another paper on zinc entitled Zinc Supplementation Decreases Incidence of Infections in the Elderly. Effects of zinc generation of cytokines and oxidative stress, all right? Pretty much saying the same thing. All right, here's another one. Zinc modulates mRNA levels of cytokines. Remember, cytokines are chemical messengers, can be either pro-inflammatory or anti-inflammatory. In the case of COVID-19, causes pro-inflammatory cytokine release. Basically, this is saying zinc plays an important role in mediating immune function. Zinc deficiency leads to frequent microbial infections and decreased natural killer cell activity. Remember, we talked about natural killer cell activity at the very beginning. I told you might want to remember that, write it down. Natural killer cells are a branch of the innate immune system, the Th1 innate immune response that fights pathogens. All right, here's another paper on zinc. I think I hit it pretty hard already. This one specifically showing how zinc inhibits coronavirus replication. All right, so let's get into the next one. Vitamin D, another essential and important supplement. This paper entitled Vitamin D Deficiency Promotes Epithelial Barrier Dysfunction and Intestinal Inflammation. All right, so again, epithelial barrier system. We talked about where those are: nose, back of the throat, upper respiratory tract, lining of the digestive tract. Um, this paper is saying vitamin D deficiency directly promotes breakdown of those barrier systems. Again, those are also considered, at least in the nose and the throat, the mucosal membranes, where first line Th1 defense happens and attacks virus before it can replicate further and spread. Okay. Vitamin A. Vitamin A essentially does the same thing. This paper entitled Vitamin A Inhibits the Action of LPS. LPS is basically a toxin released by bacteria in the intestines. And LPS, basically vitamin A inhibits the action of LPS, these toxins, on intestinal epithelial barrier function and tight junction proteins. Okay, vitamin A is one of the most commonly used nutrient supplements. It is considered anti-inflammatory, suppresses inflammatory response. And so on and so forth. You guys can read that on your own because I'm running a little over on time. Here's another paper. This was in Pediatrics in 1993, basically using vitamin A, high dose vitamin A for the treatment of measles. Interesting, right? You guys can read through that on your own time. Basically, vitamin A is super effective for decreasing morbidity and mortality rates in children infected with measles, right? It's commonly used in other third world countries, and it's injected at a high dose. In the United States, it is not. And the United States relies on vaccine. That's all I'll say about that. Here's another paper basically saying the same thing about the use of vitamin A in the use of measles. Here's another paper called Oral Mucosal Immunity. This paper is basically saying the oral epithelium and its associated lamina propria provide a physical barrier that protects the underlying tissues from invasion by microorganisms. That's pretty much what we've been saying the whole time, and blocks the penetration of some environmental threats, right? Environmental threats being bacteria, virus, different pathogens, so on and so forth. This protective mucosa is endowed with cells of the innate arm of the immune system, right? Innate immune system, Th1, first line of defense against viral pathogens. Okay. Next paper, the microbiome and the lungs. So this is like one of a kind paper explaining how not only does the intestines and the digestive tract have a microbiome, but the lungs, inside the lungs, there is also its own unique microbiome. The mouth, the oral cavity, also has its unique microbiome. And so when we have chronic infections or issues in these different tissues, or in the mouth, for example, gingivitis, oral infections, chronic cavities, things like that, maybe it's not about an issue of hygiene, but an imbalance of the good and bad bacteria in those tissues. Okay, very, very, very interesting paper. The more diversity and health you have of the microbiome in the lungs or those other tissues, the better you fight infections and better response you have with the immune system. Okay, all right, now this paper looking at glutathione, right? Glutathione, you're gonna wanna write that down. Glutathione is another supplement that is hugely beneficial specifically for the lungs and to support Th1 innate immune responses. This paper specifically is looking at, let me see, inflammatory lung diseases are characterized by chronic inflammation and oxidative stress and antioxidant imbalance. It says alterations in alveolar and lung metabolism are widely recognized as a central feature of many inflammatory lung disorders, such as fibrosis, idiopathic pulmonary issues, acute respiratory distress syndrome, cystic fibrosis, and asthma. So remember, nearly, 70-80% of COVID-19 patients ended up with chronic inflammatory lung issues. And that's why they require that's why they go into respiratory distress and require ventilators. That's why there's such a high demand for ventilators right now. This paper is showing that glutathione specifically controls inflammation within the lungs and improves outcome of fibrosis, scarring of the lungs, and lung damage. Right, so glutathione. Now, another form or another thing to look for apart from glutathione is NAC, which is N-acetyl L-cysteine. It's abbreviated NAC. It is a precursor to glutathione. It is much cheaper and easier to find. Glutathione is a little more difficult unless you have a very high pharmaceutical grade glutathione that you're getting from a doctor like myself. It does not pass through the digestive tract very well and does not get into the bloodstream very well. We use a product here called trisomal glutathione, which actually has glutathione and NAC and other forms of glutathione in it to make sure it does get through the digestive tract into the bloodstream. Right? So let's talk about activating Th1 immune response. I know I'm running a little bit behind. I'm almost to the end. Activating Th1 immune response, minimize viral replication and spread. That's the main purpose of a healthy, active Th1 immune response. And we want it to be robust, efficient, and immediate. Right? So how do we do that? Well, this paper is showing how the use of resveratrol and quercetin, which is two other supplements you can write down. Resveratrol, quercetin, spelled Quercetin. This paper specifically entitled Nutraceutical Activators of AMPK SIRT1 Axis Inhibit Viral Production and Protect Neurons from Neurodegenerative during an HSV1 infection or a herpes simplex viral infection of the type 1. That's oral herpes. Okay, so in this paper, we see that resveratrol and quercetin are very good at stopping viral replication, protecting brain cells from damage from an HSV1 viral infection. Right? Here's another paper looking at the use of echinacea for supporting the immune system. Now, this paper looked at 3 different types of echinacea, but the conclusion was they all worked. Some worked better than others. So at the bottom, in the middle, it says here, the 3 herb extracts induce similar but differential changes in the percentage of immune cell populations and their biological functions, including increased percentage of CD49 and CD19 lymphocytes in spleen, and natural killer cell cytotoxicity. So there's that word again, natural killer cells, part of the Th1 innate immune response. Okay, so there you have echinacea is another one. Here we have a comparison between echinacea ashwagandha, which is another popular herb supplement, ashwagandha, and another one called Brahmi, or the other word for it is Bacopa, Bacopa. In this study, it compared the 3. Basically, it said the same thing. I'll read you the conclusion. Herbal remedies based on echinacea, Brahma, and ashwagandha can enhance immune function by increasing immunoglobulin production. Furthermore, these herbal medicines might regulate antibody production by augmenting both Th1 and Th2 cytokine production. So it modulates and affects the immune system on both ends of Th1 and Th2. Ginger is another one. This paper specifically is looking at how ginger prevents too much Th2 dominance. Remember, when Th2 is high, Th1 tends to be low. When Th1 is high, Th2 tends to be low. There has to be a perfect balance of high-low between the 2 arms of the immune system. People who are chronically ill, chronically inflamed, tend to be Th2 dominant. So one of the other strategies we can use is actively trying to bring down Th2 immune response, while at the same time supporting the Th1 response. Okay. Let's see what else we got. Oh, mushrooms. So this was an interesting one. So this specifically is looking at mushrooms of the cordyceps, shiitake, maitake, and reishi mushrooms. Title of the paper: Anti-inflammatory and immunomodulating properties of fungal metabolites. Okay. Specifically, it says we discuss current information on the ability of extracts and isolated metabolites from mushrooms on their to modulate immune responses. If I skip around here, in particular, the ability of selected mushroom extracts to modulate the differentiation capacity of CD4 T cells to mature Th1 and or Th2 cells, right? Basically, the summary, these mushrooms help drive Th1 immune responses to drive the innate immune response to fight viral infections, okay? Now, this is one I just added in yesterday, melatonin and the use of melatonin. Now, this melatonin is actually pretty unique. I don't typically like using melatonin or having patients take it. Melatonin also available over the counter. Usually people take it to help them sleep because melatonin is known as our sleep hormone. But there's some research coming out showing that melatonin specifically attacks the inflammatory mechanism that drives COVID-19, right? So we're still waiting on more papers and more research to come out on that, but potential to basically stop this whole inflammatory mechanism of COVID-19 specifically. Now, remember, I told you that sleep is very important and vital to immune system function. The reason for that is because when we sleep at night, melatonin is at its highest. Melatonin is a Th1 stimulating product, and you can see this paper here on the left entitled The Role of Melatonin in Immunoenhancement, Potential Applications in Cancer. And it goes on to describe how it drives Th1 immune response. We have another paper here on the right called Effects of Melatonin in an Experimental Model of Ventilator-Induced Lung Injury. So this research is also showing that, well, first thing you need to know is putting someone on a ventilator inherently causes lung inflammation and lung damage. So this is probably not, this worsens outcomes for these COVID-19 patients who are becoming seriously ill and requiring ventilation or use of a ventilator, because that furthers inflammation when it's done. This paper is showing that melatonin actually improves and decreases inflammation of the lungs when someone is ventilated. I want to say, yes, okay, perfect. Let's see. So let's see at the bottom here, ventilation with high pressure induced severe lung damage and release of IL-6, which is a pro-inflammatory chemical. Treatment with melatonin improved oxygenation and decreased histological lung injury, right? But the part I didn't highlight is that it goes on to say that even though it did help decrease lung injury and lung inflammation, it increased oxidative stress. So that's why we have several steps to this process of strengthening barrier systems, driving Th1, and then the very last is calming inflammation or free radical damage, which we're going to talk about shortly. Okay, so melatonin, and again, melatonin highest at night, lowest during the day. Kids, pregnant women tend to have the highest amounts of melatonin, and that is a possible mechanism as to why they are the least susceptible, right? I don't think there have been so few documented cases of infections with 19 and younger years old that one of the theories is that also mothers transmitting the infection to their newborns. because of such high melatonin levels that they have. Okay, so manage, and then the last piece here, manage inflammatory storm. So this, basically just one paper here. We want to manage the oxidative damage, the free radical damage that's being caused from the immune response. And we're using basically bioflavonoids, plant-based products, turmeric, resveratrol, vitamin C, omega-3 fish oils, right? And so half of these we already talked about earlier, because what's great about vitamins and supplements is that many times they affect multiple mechanisms and have multiple therapeutic avenues, where a medication is designed to basically attack one specific mechanism. So a lot of the things you're doing to support Th1 response and strengthen barrier systems also manages inflammation, and does multiple things, right? So this paper, oh man, system blacked out again. 1 second. There we go. Okay, so this paper is basically showing the use of multiple different types of plant-based herbs supplements to in this paper called Inflammation-Mediated Obesity and Insulin Resistance as Targets for Nutraceuticals. So that's the title of the paper. Basically, it's saying the use of specific nutraceuticals, which I'm going to talk about right now, stop inflammation and decrease the risk of type 2 diabetes from obesity, right? And like I said earlier, curcumin or turmeric is one of the products listed here. Capsaicin, which is found in red peppers, or the skin of red peppers, has lots of anti-inflammatory properties. Omega-3 fish oils, which are known as polyunsaturated fatty acids. Resveratrol, and we have ginger again, which we know ginger, we talked about earlier, decreases Th2 immune response, which will help directly influence positive Th1 response. And different flavonoids here like EGCG, which is the active ingredient in green tea, and anthocyanins as well, which are found in red fruits and vegetables. Okay. All right, so quick review of what I talked about. We want to have a strong barrier system and mucous membranes. We do that by using things like L-glutamine, zinc, microbiome, improving our microbiome diversity. That's where your probiotics, your prebiotics, fibrous foods, kimchi, fermented foods help improve that. We have your vitamin D, vitamin A, N-acetyl L-cysteine, also known as glutathione. You want to have a strong Th1 response. We do that by using things like echinacea. Black seed oil has also been shown to do that. Ginger root, mushrooms, the mushrooms we talked about, ashwagandha and bacopa. And we want to resolve that inflammatory response towards the tail end, which is we want to avoid the cytokine storm and prolonged inflammatory state. Again, we talked about how we do that with fish oils, turmeric, resveratrol, also vitamin D, also vitamin A. All right, perfect. So what can I do for those of you here listening or others that want to protect their immune system or help protect their family? Well, this is a product, and if you haven't looked already in the stores, some of these supplements were selling out pretty quick. People were hoarding and stocking up. This is a supplement product that one of my sellers offers, which is pretty awesome. Basically, it's individualized packets. You get 4 or 5 capsules in each little packet, and it has all this stuff in it. And if you look at it, it pretty much has everything we just talked about. You got echinacea, you have green tea extract, you have all your different types of mushrooms in here, you have your N-acetyl L-cysteine, which is your glutathione precursor, you have vitamin A, vitamin D, you have vitamin C in here, you have quercetin, and you have zinc. So that hits almost everything we talked about. This would be a good thing to be on preventative wise. Some of the dosages are a bit too low. one thing I didn't talk about specifically and on purpose was dosages of each supplements, because it varies based on how inflamed you are, how low your levels are when we actually test them and look at them, and what your autoimmune status is, right? So high autoimmunity, low autoimmunity, if you're immunocompromised, which is another thing we screen for on a blood test, these need to be in different proportions, okay? So I would recommend this to start with, but I would also recommend certain things need to be at higher dosages, so you couple other products with this to get optimal therapeutic benefit. Okay, here's another company that we use often for our patients. Look at that, TH1. This product is just called TH1 Support. Everything we've already talked about. This product here, innate immune support, pretty much other things we just talked about, with astragalus, mushrooms, etc., etc. All right, perfect. So that's the end of that presentation. We did get a lot of questions come in, so I'm going to try to go over a few of them for you. Again, those of you who tuned in a little bit later, some of you who turned in a little bit later, if you're interested, basically what I'm offering all of you who registered and tuned into the webinar is a free 30-minute consultation. We have a set of forms you can fill out that will help us assess, or help me assess, what your baseline inflammation levels look like. You fill it out at home, you send it back to us, we review it. We basically sit down with a virtual chat or over the phone. Okay, you don't have to leave your home. It can be done from your home. We review your intake forms. We talk about possible sites of inflammation, what you should do to improve that, how we can clinically assess that with lab tests, and then my recommendations of what kind of baseline supplements maybe you should be on to help support your immune system at this time, right? So again, what you want to do, that's the offer. You want to text us at 408-752-5453, and make sure you text the word immune, IMMUNE. Again, text immune to 408-752-5453. What that text, that's an automated text system. So what that does is it responds and gives you access to my calendar. There you can schedule your own consultation. It is a free consultation. We'll get the paperwork to you through email, and then we will see you then. All right, so there's my information again. This is our office number. Our office phone number is different from the texting number. Be aware of that. So let's get into some of the questions that came in here. So is the immune support packets good for kids? I would say yes. The dosages are pretty low. It would depend on age. A safe bet would be, vitamin D, vitamin A as well. Again, I'm not going to mention dosages unless you are already a patient or we do the consultation. We got another question. What about nightshades and inflammation? That's a really good question. So nightshades are things like peppers, potatoes, eggplant, things like that. Nightshades are not inflammatory for everyone, but they can be inflammatory to autoimmune or immune compromised people. So it's kind of an open-ended question. If you know you have autoimmune disease or you're immune compromised, most people don't know they have those things. That's why we have to screen for them. Then nightshades do have the potential to be inflammatory. If you eat nightshade vegetables and they cause pain or swelling or any other symptoms, you probably should not be eating those. What else do we have here? Okay, so there was a bit confusion of the use of melatonin and whether I recommend it or not. Typically, I don't, but in this situation of this COVID-19 issue, it may be something you can do prophylactically, a low dose of melatonin at night. It'll help you sleep, and it'll also help drive TH1 as well. The reason we don't recommend long-term use of melatonin is because then when you don't have melatonin, people have issues creating their own melatonin and then have issues sleeping. Let's see, next questions. Are there foods that have vitamin A or do we need to take it as a supplement? So here's the issue with vitamin A. There's plant-based vitamin A and there's animal source vitamin A. There's a lot of research showing that maybe 30-40% of people do not actually convert plant-based vitamin A to the active form needed. And so where you find vitamin A in food, liver meats, chicken liver, basically animal sourced. The vitamin A I use in my office is sourced from fish, cod liver oil. And I have found it to be much more effective and therapeutic than plant-based vitamin A. Okay. Let's see. Do testing on kids as well. Yes, it depends on the age and it depends on how well they do with needles. We can talk about that in our private consult if you want to know more. Let's see. So another good question, since so much of this is related to inflammation response, if we keep inflammation under control, it would help to minimize likelihood of the virus. I would say not necessarily likelihood of the virus, but likelihood of symptoms or severe symptoms of the virus. Um, Really, we want to drive a Th1 innate immune response to minimize likelihood of spread of the virus past our epithelial tissues of the nose and the back of the throat. I did have the question about Advil. We talked about that. And I think I answered why weren't SARS and MERS a pandemic. We talked about that. They were more epidemics because they were much less infected. Perfect. And let me check one more thing. I do have two more questions. Is there a test to check your Th1, Th2 response? Unfortunately, no. I wish. There are a couple of labs that were trying to do that. I think the results were inconsistent. So there's no direct way to actually test that as of now. Advice on how to take all the suggested supplements. Is it safe to take all together? That's a good question. Typically, yes. It depends on dosage. It depends on your tolerance. Again, some people may not tolerate certain supplements or high dosage of supplements. So that's why I always monitor them over time and tweak dosages as necessary. Zinc specifically can cause a small percentage of people to feel nauseous after they take it. The way you get around that is you eat food first, have a full stomach, and then take the zinc. That's one possibility. And then some things like vitamin A can have a potential to be toxic at high doses for too long. So that's another reason I didn't talk about dosages, and I won't unless I meet with you one-on-one through the virtual consult or unless you're already an existing patient. All right. Perfect. So remember, I hope you guys enjoyed this. I hope it provided some value to you. I hope it helped calm and put a different perspective on this whole situation. My 2 cents on the quarantine. The purpose of the quarantine was to slow the spread of the virus so that hospitals can prepare appropriately and disperse the amount of sick that hit in there all at one time. It is not meant to stop the spread of the infection because it's impossible at this point to do that. From the time China had their outbreak to the time the United States closed off travel from China, about 5 million people came into the United States from China. So 5 million people with the potential to already have been infected before closing the border to them. Realistically, we're not going to stop the spread. We're just slowing and delaying the amount of influx into hospitals of those compromised people, right? So I don't expect the quarantine to last much longer or to be extended. Now, the other big issue is in the 1918 flu pandemic, they also had recommended quarantining of people. But what they noticed was that they ended up having a second wave of infection and then a third wave of infection. And that's because not enough people became infected, built immunity to the infection because they were quarantined, and then they had secondary and third spikes in infection rates. Eventually, when enough people become infected and build immunity, um, we'll be all good. But until then, definitely take the quarantine seriously, because we want to limit the flood into hospitals for the people who need those medical services. So that's just my 2 cents. All right. Thank you, everyone. I'll be emailing you basically the recording of the webinar. You can share it with who you like. Remember, power through education and knowledge. Don't fall into the hysteria and the panic. And don't forget to text us if you're interested in the free consultation. We'll even review any old blood work you may have from other doctors and give you kind of our professional look and opinion on it. All right. Thank you very much. Stay safe. Stay healthy.